Hey guys, and welcome to How to Gastro. So in today's video, we'll be exploring what is human chorionic gonadotropin, or a HCG, or also commonly known as a Beta-hCG blood test. So let's get started. So before we get into the specifics of the Beta-hCG test itself, let's take a closer look at what you can expect when your doctor orders this test for you. So the Beta-hCG blood test is a simple test that can be done at your closest laboratory. No special preparation is needed for the Beta-hCG test, which means you don't have to fast, so you can eat and drink as usual before the test. During the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, usually in your arm, to draw out some blood into a gold top, which is an SST blood tube, or a green top, which is a heparin blood tube. This blood tube is then sent off to a laboratory where it is analyzed and resulted. So what is Beta-hCG and what is a Beta-hCG blood test? So a quantitative human chorionic gonadotropin, or an HCG blood test, measures the specific level of HCG in the blood. HCG is a hormone that is produced by the cells of the placenta during pregnancy. The hormone stimulates the corpus luteum to produce progesterone to maintain the pregnancy. It appears in the blood and the urine of pregnant women as early as 10 days after conception. The quantitative HCG measurements also help determine the exact age of the fetus. It can also assist in the diagnosis of abnormal pregnancies, such as ectopic pregnancies, molar pregnancies, and even possible miscarriages. It is also used as part of the screening test for Down syndrome. So this test is also done to diagnose abnormal conditions not related to pregnancy that can raise the HCG levels in the blood, such as disorders affecting the pituitary gland and hormone levels, or cancers of the ovary, bladder, kidney, liver, lung, colon, breast, and stomach, and ovarian cysts that may also produce HCG. So now that we know what HCG is and what the Beta-hCG blood test is all about, let's take a closer look at what the normal results look like for this test. So results for HCG are given in milli-international units per milliliter, and normal levels in non-pregnant women are usually less than 5 milli-international units per milliliter, and in healthy men, it's usually less than 2 milli-international units per milliliter. So as mentioned in the previous slides, the Beta-hCG level is also important for diagnosing the gestational age, which means the actual age of the fetus. So below are the typical ranges by weeks in pregnant women from their last menstrual period, or LMP. So 3 weeks post-LMP, ranges should be around 5 to 50. 4 weeks post-LMP, ranges should be between 5 and 426. 5 weeks post-LMP, ranges should be between 18 and 7,340. 6 weeks post-LMP, ranges should fall within 1,080 and 56,500. 7 to 8 weeks LMP, ranges should fall within 7,650 and 229,000. 9 to 12 weeks post-LMP, ranges should fall within 25,700 and 288,000. 13 to 16 weeks post-LMP, ranges should fall within 13,300 to 254,000. 7 to 24 weeks post-LMP, ranges should fall between 4,060 to 165,400. And 25 to 40 weeks post-LMP, ranges should range between 3,640 to 117,000. So after a pregnancy ends by birth or perhaps from a miscarriage, the HCG levels should return to non-pregnant levels within a few weeks. So now let's talk a little bit about the abnormally high Beta-hCG levels on a blood test. So abnormally high levels of beta-hCG can indicate several conditions, some related to pregnancy and others related to non-pregnancy related health issues. So here are some common causes. So number one, we have multiple pregnancy. So twins, triplets or more. So pregnancies involving more than one fetus, for example in twins or triplet pregnancies, typically result in higher than normal hCG levels because more placental tissue is present and producing the hormone. Number two, we have molar pregnancies. So in this case, we can have a hydatiform mole. And here we have a complete molar pregnancy. And this is a type of gestational trophoblastic disease where abnormal tissue grows inside the uterus instead of a normal embryo, and it can produce extremely high levels of hCG in the blood. We then have a partial molar pregnancy, and in this condition, there is an abnormal embryo and placental tissue, leading to elevated hCG levels, though usually not as high as in a complete molar pregnancy. The third cause for abnormally high beta-hCG levels is a choriocarcinoma, and this occurs in cases of gestational trophoblastic neoplasias. So these are rare, fast-growing cancers which occur in a woman's uterus after a molar pregnancy, miscarriage or abortion, or even a full-term pregnancy. It can also cause very high levels of hCG to appear on a blood report. So continuing with causes for abnormally high beta-hCG levels, at number 4 we have hCG producing tumors. So these are usually germ cell tumors, like some types of ovarian or testicular cancers, which produce hCG, leading to elevated levels in both men and non-pregnant women. And other malignancies can also cause high hCG levels, as we mentioned in the previous slides, including malignancies of the liver, stomach, or pancreas. At number 5, we have inaccurate pregnancy dating, and this occurs in gestational age miscalculation. So sometimes the pregnancy is further along than we initially thought, which can make it seem like the hCG levels are abnormally high when they are actually normal for the true gestational age. At number 6, we have Down syndrome. So in some cases, elevated hCG levels, particularly in the second trimester, may be associated with Down syndrome, also known as trisomy 21. So this is actually one of the markers that is used in prenatal screening tests for Down syndrome. And here we'll see abnormally high beta-hCG levels as well. And finally, at number 7, we have hCG medications. So women undergoing fertility treatments may receive hCG injections to trigger ovulation, and this can temporarily raise the hCG levels on a blood test, making it seem like the beta-hCG is abnormally high. So now that we've covered all the causes for abnormally high beta-hCG levels, let's talk a little bit about what causes abnormally low beta-hCG levels. So abnormally low beta-hCG levels during pregnancy can be concerning and may indicate several possible issues. So here are some of the most common causes. So coming in at number 1, we have a miscarriage. So low or declining hCG levels can be an early sign of a miscarriage, especially if they are not doubling every 48 to 72 hours during the first few weeks of pregnancy. A significant drop in hCG levels may indicate that the pregnancy is no longer viable. At number 2, we have ectopic pregnancy. So this occurs when the embryo implants outside of the uterus, most commonly in the fallopian tubes. Ectopic pregnancies often result in lower than normal hCG levels, and the increase in hCG may be much slower than expected. So this condition is a medical emergency and requires prompt treatment as well. At number 3, we have a blighted ovum, which is an anembryonic pregnancy. So this is a condition where a fertilized egg implants in the uterus, but the embryo does not develop. So here the gestational sac may continue to grow, but hCG levels may remain low or even plateau, indicating that the pregnancy is not progressing normally. At number 4, we have the miscalculation of pregnancy dates. So if the gestational age of the pregnancy is miscalculated, for example, if ovulation occurred later than expected, hCG levels might appear lower than expected based on the presumed gestational age. And in some cases, follow-up testing might reveal that the pregnancy is indeed progressing normally, and there's nothing to be worried about. And at number 5, we have fetal demise, which pertains to intrauterine fetal demise. So in some cases, the fetus may stop developing, leading to a drop in hCG levels. This condition requires medical evaluation and management as soon as possible. So as we have just seen, Beta-hCG plays a pivotal role in pregnancy detection, monitoring, and management. It is also a valuable marker in diagnosing certain cancers and guiding fertility treatments in women who are trying to conceive. Due to its importance in both pregnancy and non-pregnancy contexts, Beta-hCG is a key hormone in reproductive health and medicine. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this presentation very valuable and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community. Thank you guys for all the support. And I've recently actually signed up with Buy Me a Coffee. So if you want to encourage me to do even more or to say thanks for the free information you've received on my channel today, you can buy me a coffee. The link is down in the description box below. Take care and have a wonderful day further. Bye for now.